So yeah, I'm Dr. Halasa, the founder of Chronic Disease Prevention and Management, and we're looking to also have some society of chronic disease prevention and management. I think something, Mike Beamer, you sent me something about in September in Pennsylvania, there is some big meeting for chronic disease prevention and management. Can you talk about it a little bit? Dr. Mike, are you there? Okay, he's muted. Can you hear me, guys? Hello?
Yes.
Okay, good. Dr. Mike, are you there? I think he went somewhere. Okay.
No, I'm here.
So there's a meeting that's coming up in Pennsylvania about chronic disease prevention. You sent me an email. Can we get that going? Because it's a good one.
Yeah, I will. Yes, we can talk more about that. Yes.
All right, great. So we want to propose a new terminology for oxytocin system because I tried to find the word oxytocinic system in Google. There is none. That term is new, brand new. I think we just invented, and it needs to be invented. We need to have a complete understanding of this system. It's equivalent to endocannabinoid system, where we have receptors all over the body, centrally and peripherally. And we know that endocannabinoid does help to restore the homeostasis of our body, but not as effective as what oxytocin can do. And it's not just a neurogenic, it's not just central, it's also peripheral. So we have oxytocin receptor all over our body, in muscles, bones, in our blood vessels, and our brain. So it's centrally and peripherally. And it's fair enough for us to start talking about the system and how it is, or how it's resetting the homeostasis of our body, which will lead to slow the process of the aging, manage chronic disease across all medical specialties, including also preventing, not just managing. And this is the oxytocinic system. As you see here, that the oxytocin does help to modulate the immune system. It helps to restore the metabolic homeostasis, and it does buffer the redox by inhibiting the NOx enzyme. And we're going to learn that how this oxytocin helps in restoring the homeostasis by restoring the homeostasis of the metabolism and the immune and the redox. And let's start with how the oxytocin restore or balance the hormones of your body. And if you see here that the oxytocin does buffer or inhibit the thyroxines, because you don't want to have too much of thyroxine, especially during stress, because that will lead to activation of the sympathetic. Sympathetic release the norepinephrine. Norepinephrine stimulates the NOx and generate free radicals and makes the inflammation more worse, right? So you need to buffer that. You need to restore the homeostasis and buffer any increase in the thyroid function. And it's an anti-inflammatory doing that, because we know that the thyroxine stimulates the sympathetic, and sympathetic is the inflammatory arm of autonomic nervous system. And also we see that oxytocin helps to buffer the pituitary or the hypothalamus pituitary adrenal axis, right? And so, and doing that, you decrease the amount of cortisone. And it's very important, because too much of cortisone, what will happen? You will suppress your immune system, and this will put the patient at risk of infection and cancer. And so having oxytocin helps us to buffer the cortisone and normalizing it. I think it's a good thing to prevent cancer and prevent infection, because too much of overactive cortisone can lead to infection and cancer. And it can definitely aggravate underlying chronic diseases, and it increase, for example, the insulin resistance and many other things, and hypertension, all that. So just managing the cortisol level and restoring it back to normal by decreasing it with our oxytocin, it may help a lot in preventing all those cancer and infection, or triggering or aggravating underlying chronic disease. So oxytocin also helps to increase the sex hormones, that's very important, right? Estrogen and androgens. And doing that, you slow the process of the aging. Yes, you also, estrogen is very important in improving the endothelial function, so you decrease the incidence of stroke and myocardial infarction, and definitely this is very important to continue having normal level of androgen. Estrogen, as we know, it drops with age, and it drops with stress, and I think oxytocin will help that. Oxytocin helps to increase the insulin secretion, but not just insulin secretion, insulin sensitivity, which is very important. You don't want to have too much of insulin without increasing the insulin sensitivity as well, because it buffers the redox, and it decreases the activity of the insulin receptors and getting the sugar in. So this is very important, and so this will prevent us from having diabetes and other things, or atherosclerosis and all that good stuff. Also, you see here, the oxytocin helps to inhibit the bad inflammation, and most of the bad inflammation is mediated by Th17, M17, interleukin 6. This area with neutrophilia, whether it is when you have autoimmune diseases or inflammation that's mediated by Th1 or dominant by Th1 or Th2, you will see that there is a components of Th17 inflammation in either side. So let's say in rheumatoid arthritis, yes, it's Th1 dominant, but there's also Th17 there. And in allergy, there is Th2 dominant, but also there's Th17 there. And so inhibiting this overactive Th17, this neutrophilia, this damaging or hyper immune response mediated by Th17, M17, interleukin 6, I think it's a good thing in managing inflammation or inflammatory disease in both sides of the aisle, whether it's Th1 or Th2 dominant. And also it would help cancer also. So anything that have the Th17 would help cancer, because in cancer, you want to have the immune system polarize the Th1. You don't want it to be moving to Th17 and neutrophilia, because neutrophilia cannot kill the cancer as effective as Th1. So when you inhibit that, you restore and resume the polarization Th1 and killing the cancer. But if you stimulate that, then you are polarizing the immune system away from the effective Th1, and that will cause an emergence of the cancer. So this will help to prevent cancer from happening and manage it as well. At the same time, oxytocin helps to stimulate the thymus gland to secrete all those thymosin peptides, which stimulates the maturation of the T cells and the polarizations of the immune system. So it enhanced the immune system, but it enhanced the immune system and balancing it in a way, it will increase the tolerance to your self-antigen, but it will enhance the immune system against the pathogens, and whether it's cancer or infection. So that's oxytocin. So it's kind of immune enhancement, but in a good way. Immune enhancement in a way that it will increase the self-tolerance, but at the same time, it will be acting against any pathogens or cancer that's trying to destroy the body. And yes, we know that the oxytocin buffer the cortisone, and so you don't have too much of excess of cortisol, which will lead to all the problems that we know whether it's immune suppression or diabetes or aggravated diabetes or causing hypertension. So you want to buffer that, and you want to have enough of cortisone or a burst of cortisone, not a constant increase of pathological cortisone, but a burst that will just help to decrease any excess of inflammation, but not too much of it, where it's a waste and possibly suppress the immune system, where it put the patient at risk of infection and cancer. Oxytocin also helps to increase the diuresis because it stimulates the heart to secrete the arterial nitropeptide, natriuresis peptide, which helps to get rid from all this excess fluid. And that's why, you know, people have baggy eyes. Maybe it's because of inflammation under the eyelids or swelling and edema and all that. Intranasal oxytocin will be a good way to get rid from it because it helps to get rid from all this excess salt and water that the body does not need it, and definitely helps the blood pressure doing that, right? And it helps the heart by doing that. So natriuresis, which is stimulating the arterial natriuretic peptide. Oxytocin, we know it helps to shrink the fat. It stimulates the beta oxidation, the lipolysis. That's a good thing, right? Because you don't want to have fat. Too much of fat, especially the white fat, is all the time. It's secreting inflammatory cytokines, interleukin-6. So, and that's not good because those interleukin-6 and this kind of inflammation around the white fat, it definitely causes degeneration of the muscles, and it causes insulin resistance. So definitely, white fat is not good to be built in our body. Too much of it, so we need to get rid from it as much as we can because they are a source of inflammation, and they can cause muscle atrophy and definitely even the stem cells that's being extracted from those white fat are not as effective as the stem cells extracted from the brown fat because they are very rich with M1 instead of M2, and also very rich with M17. And you really need to have that M-reg in those stem cells, which is the anti-inflammatory. So harvesting stem cells from brown fat is better than the white fat. So even if you have a skinny person, their fat stem cells quality is better than the one that you're taking from obese, inflamed white fat cells. And oxytocin converts, because it stimulates the mitochondria biogenesis. It converts those white fat into brown fat, which is a good thing. Also, as I said, oxytocin helps to increase the insulin and insulin sensitivity, so it increases the glucose uptake. It breaks down the fatty acids. It's anabolic, so it increases the protein synthesis, which is very good thing because that would help to regenerate the muscles. And yes, it does help to use the ATP as much as so energy expenditure. The oxytocin increased it, but it decreased the ATP production. It decreased the AMP, which helps to stimulate the AMPK. And the AMPK will stimulate the autophagy and fatty acid oxidation. We're going to see that in the coming slide, which is very important. Shows that oxytocin, how it stimulates autophagy process by stimulating the AMPK, which is the kinase protein that leads to signaling of the autophagy. Oxytocin also helps to stimulate the bone formation, so you can use it to manage osteoporosis. Oxytocin helps to increase the colonic motility, which is good for constipation. I think doing injection of two international unit around umbilical, it's a good idea for managing constipation because it does help to increase the colonic motility, and that's a healthy thing. Well, also oxytocin helps to improve the endothelial permeability. In other words, it helps the leaky gut syndrome, and also it helps to manage leaky gut syndrome by increasing the tight junction and prevent the leakage of the pathological free radicals from the gut, and pathological free radical generator, which is lipopolysaccharides from the bacteria. And also it helps to manage the blood-brain barrier. So it manages the leaky brain syndrome as well by increasing the healing and the tightening of those endothelium and preventing the leakage of the free radicals generators into the brain or from the gut into your blood. So oxytocin will be a good a drug for managing leaky gut and leaky brain syndrome. And yes, oxytocin increases the nitric oxide, so it does help in angiogenesis and vasodilation, something that's good for the heart, right? When you have ischemia or angina, you need to increase the blood flow. Again, it stimulates the arterial natriuretic peptide, which causes the diuresis, and that helps the heart, right? Especially if you have heart failure and you want to get rid from the excess of the fluid, then oxytocin will be a good thing. And also, when you have ischemia and you have myocardial infarction, you really need to have something that has anti-inflammatory, which oxytocin does, because it inhibits the NOx and it inhibits the interleukin-6 production. But also, it slows down the heart rate. But that's what you need in myocardial infarction, and you want to slow that. And that's part of the management of myocardial infarction and angina and heart failure. The other thing that oxytocin stimulates the breathing rate, and that's good for sleep apnea. It's good for asthma. It also helps to decrease the inflammation, so it's good for allergies. It blocks the NOx enzyme, so it decreases the inflammation. But what we know of oxytocin is that when we are in medical school, we know it's part of helping the women to deliver the baby by contraction of the uterus, and also it helps in the nursing. That's what we learned before in medical school. All this new information about oxytocin is resetting the homeostasis of the metabolism in your body, the hormones. It buffers the redox. It modulates the immune system. It enhances the self-immune tolerance, and it enhances the immune our immunity against the cancer and the pathogens. All of this is our new information that we're learning today, and that's the reason we create or we develop or rebrand a new system in our bodies called Oxytocinic system. And again, it's not a neurogenic neurons of oxytocin only, but it's also peripheral. So it's a central and peripheral, because we have hormones, we have neurotransmitters, we have receptors in the brain, and we have receptors all over the body. And that's the reason, I think that's a justification to label or create or recognize an oxytocin. It has a system, it's called oxytocin system, oxytocinic system, and it does help to reset the homeostasis of the body, which will slow the process of the aging. So it's an anti-aging drug. And also, if you see it here, it's really managing, and it hits the pathophysiology of all chronic disease across all medical specialties. And we learned that just by one slide of today. But in addition to that, oxytocin, we have a lot of neurons in our brain that's oxytocinic, and it involved in social recognition, it involved in social behavior, social memory. It does help in managing anxiety and anhedonia, which means that helps the patient with depression. Why? Because it increases the happy molecules, right? We know oxytocin increases the serotonin, dopamine, and caffeine. So it increases the happy molecule. It helps in pain management because it increases the opioids and enkephalins, and it enhances the activity of descending analgesic pathway. In fact, there is oxytocinergic neurons in the descending adjacentic pathway that inhibit the ascending nociceptive pain signaling at the spinal cord level and at the amygdala as well. So it has analgesic effect. It induces sleep. It promotes melatonin and it induces sleep, deep sleep. That's a good thing. So it can be an assistant for the sleep. And yes, it helps to manage an anxiety and depression. It just tunes those happy molecules. You don't want to have too much of excess of those happy molecules where you end up with an anxiety, but it tunes it up in a way at the physiological level. So that's the reason I prefer oxytocin over melatonin or any other antidepressant drugs, because oxytocin tunes it, balances it, does not give you that excess amount of serotonin where it causes a side effect, or excess amount of dopamine where it drives the patient crazy. It just tones it into that physiological level that we need to have this normal brain social recognition, cognitive function as well. So you can use it to manage because of that, and because of its and increasing those happy molecules, you can really use oxytocin to manage all neurological diseases and dementia and even immunological disease. And also it helps the pair bonding, which is good. It helps us to connect with each other, because the more you connect, the more you have bonding, whether with your wife or with your spouse or with your friends. The more oxytocin is produced, the more rewarding for that as well. And it helps that relationship between you and your dog, you and your kids. So definitely increase that affinity and all that. But also it increased your five sense, maybe six sense, the five physical senses that we have, which is smell and taste and vision. So it increased the acuity and the function of all those five senses, and possibly the six senses as well. Okay, so let's go to another slide. Okay, so this is just repeating what we just learned here, and I think it's the same thing. I think we talked about it, but just add a little bit here where it also helped to manage the ulcers, right? Because of its anti-inflammatory effect and suppression of interleukin 6, and increasing the mucosa production. It increased the mucus all over the body, whether it's nasal mucus, stomach mucus. So it helps in healing of those ulcers, and increasing the quality of the mucus, and it does help also to protect you against the virus and bacterial infection. But I think we talked about it in the previous slide. This is just emphasizing or adding more to what we just learned. So as I said, the oxytocinic system, which is the new system that we as chronic disease prevention and management docs are proposing, this new name, to be a new biological system that we need to recognize, that we can modulate and we can enhance when we are managing chronic disease or preventing it. So it's a potential target to manage and prevent chronic disease across all medical specialties. I think Dr. Joseph James, he likes to call those molecules executive molecules, because it has many, many good effects and multiple organs, and it does help to manage, I think, all chronic disease across all medical specialties as we see it here. And so it has receptors, it has pathways, it has its own it has neurons, it's hormones also, because we know oxytocin is being released from the posterior pituitary gland into the blood, right? And gives you that, not just stimulating nursing and contraction the mammary muscles, but or the uterus muscle, but also it has many other effects, as buffering the redox and modulating the immune system and restoring the homeostasis and the metabolism and the hormones, as you see it here, enhancing the immune system against the pathogens and the cancer and inducing tolerance to your self antigen. And how you stimulate oxytocin? Of course, you can stimulate oxytocin because we do have receptors and neurons that will stimulate the secretion of the oxytocin from the posterior pituitary, and there are neurons that will feed into the posterior pituitary and stimulate the release of oxytocin or stimulate oxytocin from the neurons in the brain or outside into the blood as a hormone or as a neurotransmitter. And see, the sunlight does stimulate oxytocin when you are outside, and the visual activities does help to increase oxytocin. And same like inhibiting melatonin, but increasing oxytocin here. It does stimulate the auditory function, so it increases your hearing function. It stimulates the taste, so you taste the food better. And you know, it gets stimulated by cuddling and by stroking the skin, that increases oxytocin as well. Good food also helps to stimulate oxytocin. When you eat a nice food, stimulate the oxytocin. Also, when the oxytocin is being released, it makes the food taste good. Okay, music will increase oxytocin, and also oxytocin helps to increase your auditory function, makes you hear better. Visual, looking at beautiful women or beautiful sight or beautiful handsome guy, that's for the female and male, of course. All of this will help to increase the oxytocin. Again, if you see stroking the skin, massaging, all of this will feed into the brain and stimulate the release of oxytocin as a neurotransmitter or as a hormone. What else? Abdominal breathing, yes, taking deep breath, relaxing can also help increasing the oxytocin. Breast massage or sucking, as we know that when we are in the process of the nursing the baby and getting the milk out, there is a reflex where the sucking of the nipples will cause the stimulation of the release of oxytocin, then contract and squeeze the milk out. So it leads to milk down reflex. Smelling perfume, good thing, will help to increase oxytocin. Reading and enjoying what you're reading, it helps. Meditation, all of this helps to increase your endogenous oxytocin. And in addition to that, socializing, making love, seeing your friends. Here, that in our meeting right now, where we have the same think tank, we all are our oxytocin is being increased because of this gathering. And it's being rewarded by increase of the dopamine. So oxytocin increases dopamine, and then you have that cycle of the drive into coming here and meeting with us, because this is increasing your oxytocin and your dopamine, right? And anything that increases your oxytocin and dopamine will make your muscles to be moving to that direction. To anything that increases your dopamine, you move toward it. So anything that increases oxytocin, dopamine, makes all your body to go and act on it and move to it. We're opening a computer and zooming. All of this is a process that will help to increase your dopamine, right? And it drives you into coming into this meeting. If this meeting does not increase your oxytocin, dopamine, you will not be coming here. You will be moving away from us, because you will be our movement and instant action is all about what increases the dopamine. And what's the max dopamine? The action of us will go to what goes the max secretion of oxytocin and dopamine. And so there will be a lot of comparison here in your body, in your brain, and calculation. So whether it's watching TV, that increases my dopamine, but attending the Zoom here with my friend will also increase the dopamine, oxytocin. But where the body is going to move is which one is producing more oxytocin and dopamine. And it seems like if you're here, then that is the max production of oxytocin dopamine that drives your muscles to move and open up the zoom and be here. But if you find that making love with your wife, it increases your dopamine more than sitting here, then you'll be moving to that direction to have making love with your wife, for example. Or sometimes people here are hungry and they want to eat food, and that maybe increase their oxytocin more than sitting here, and that will cause them to leave and eat some food. And so all our actions, instant action and thoughts and drive, it's whatever goes the highest dopamine and oxytocin secretion in our body. Okay, so we know that the oxytocin stimulate the AMPK, which is those are the kinase protein that helps in stimulating the autophagy, the fatty acid oxidation, the lipolysis, the shrinking of the fat. It helps to buffer the redox. It helps to uncouple the mitochondria, where you're not producing enough of ATP, you're producing AMP. And when you're producing AMP, this will stimulate more of the activation of AMPK and more of autophagy. And this will also buffer the redox. The mitochondria produce less of free radicals, and producing less of free radicals, this will lead to definitely decrease the activation of NFK beta activities. It decreases the inflammatory cytokines, and it decreases the inflammation in general. And you decrease the inflammation, that's mean you're increasing the sensitivity of the insulin and all other receptors, not just the insulin. When you decrease the free radicals, you decrease the oxidation of the receptors, you're increasing their sensitivity, right? So you're increasing the insulin sensitivity, the hormone sensitivity, and all of these can lead to managing atherosclerosis, because if you are decreasing the inflammation and you're decreasing the inflammatory cytokines and you're buffering the redox and you're increasing the autophagy of the inflammasomes, definitely you are going to manage atherosclerosis. And if you decrease the inflammation and decrease the free radicals are in the pancreas or in the muscles, and you increase the sensitivity of the insulin receptor, and you increase the production of insulin, what will happen to your sugar? The sugar will drop, right? And you preserve the insulin pancreatic secretion or the pancreatic islet by decreasing the inflammation there. And all of this will help. And when you decrease the inflammation, you also protection against the acute ischemic damage, right? And definitely activation of the AMPK will activate the lipolysis and shrinking the fat, and it goes weight loss as well. Definitely when you decrease the fat, especially the white fat, you decrease all those inflammation that's coming out from this white fat, and that leads to degeneration of your muscles. So what will happen to your muscle now? It will regenerate because of that. But also we know that the insulin does inhibit the mTOR, and very important to inhibit the mTOR, because mTOR stimulate the growth, right? But when you inhibit it, the mTOR, then you induce autophagy. And we talked about it, I think, last night, that we don't want to have a growth factors high all the time and constant, because then you will stimulate the cancer cells and inflammasome, and you will stimulate senescent cells. So what you need to drop the growth factors by inhibiting the mTOR, right? And this will cause the killing of those inflammasome and cancer cells and senescent cells. And why? Because all of this will increase the free radicals in them, and that would push them to die. While we know the stem cells will resist the spark of free radicals, and during the process of activation or inhibition of mTOR, and then once you start eating, and we're talking about fasting and then eating, or what's the whole process of this stress that leads to killing of those inflammasome and cancer cells and senescent cells, it's over, then what will happen? Your growth factor will go up and stimulates those stem cells and regenerate again. So during the process of autophagy and fatty acid oxidation, and that, it's very important, because this also helps to increase the nitric oxide bioavailability as well, and that will increase the mitochondrial biogenesis. All of this will lead to homeostasis and buffering the redox and increasing sensitivity of insulin. And then you can manage inflammation across all medical specialties, inflammations, whether it's degenerative or autoimmune or any other process, any diseases where the inflammation is the pathophysiology here. And you can manage a lot of chronic disease just by giving oxytocin, whether it's intranasal or subcutaneous. So because of oxytocin, it does buffer the redox by inhibiting the NOx enzyme, and it does inhibit interleukin 6. Just knowing that, then we can use oxytocin to manage any chronic inflammation, degenerative, autoimmune, or metabolic disease, just because of this. Because this, the free radical generation, especially the constant time of the burst, and the interleukin 6, which will mediate the inflammation of the Th17 and M17, which most of inflammatory diseases, you will see that there's an overactive production of interleukin 6, and there is overactivation of the Th17 and all those inflammatory cytokines, and they are the ones causing all this unnecessary damaging in your tissue, whether it is Th1 dominant, Th2 dominant autoimmune disease, or Th1 dominant, Th2 dominant inflammatory disease, or degenerative disease, all of them, whether it's dementia, rheumatoid arthritis, or systemic lupus, they all have some components of extra hyper Th17 and M17. So managing and suppressing it and buffering it, it definitely helps to manage all those chronic diseases, including cancer as well, and preventing them as well. And so, as you see here, that we've been experienced last 2 years the disaster of the COVID disease, and how the coronavirus led to all the triggering all those inflammatory diseases, and make those subclinical diseases to appear and become clinical, surface all the subclinical conditions, or instead of having a chronic disease, a dementia start at age of 70, then start at age of 50, and because due to the coronavirus, they trigger this inflammatory process in a vicious circle, and it causes an early onset of those chronic diseases. It aggravates any existence chronic disease. If you have diabetic, got worse. You got hypertension, got worse. If you have rheumatoid arthritis, got worse. And the reason why, because this coronavirus, it has this spike protein that hijack the renin-angiotensin system. And in old school and medical school, when we are at the medical school, I mean like 20, 30 years ago, we learned that renin-angiotensin is just more or less for controlling the blood pressure, right? But that's not the case now. Renin-angiotensin is also controlling the inflammatory process and the anti-inflammatory process of your body. It controls the autonomic nervous system activities, basically. So it's not just controlling the blood pressure, it also controls the immune system, and the polarization of the immune system. And we find out that in renin-angiotensin system, there is two components, or two sides, or two arms. there is an anti-inflammatory arm mediated by ACE2 and angiotensin 2 type 2 receptor signaling. And we have the inflammatory arm, which is mediated by angiotensin 2 type 1 receptor signaling. And we know that the angiotensin 2, which is produced by renin, is turning angiotensinogen into angiotensin 1, and then angiotensin 1 will be converting into angiotensin 2 by ACE enzyme in the lung. And then angiotensin 2, it has two choices. Either it react with angiotensin 2 type 1 receptor, and that leads to vasoconstriction and inflammation, especially it induce the M17, Th17 inflammation and neutrophilia. Or it will convert angiotensin 2, will convert to angiotensin 1,7, which is the dihexa by ACE2. ACE2 enzyme will take the angiotensin 2 and convert it to angiotensin 1,7. And then the angiotensin 1,7 will react with MAS receptor. And that is the anti-inflammatory arm, the vasodilation signaling there. So what coronavirus did, the spike protein, it inhibit the ACE2, it inhibit the anti-inflammatory arm, it inhibit the vasodilation arm, and it led to overactivation of the inflammatory arm of the renin-angiotensin system, which is the angiotensin 2 type 1 receptor signaling. And that leads to polarization of the immune system into Th17, M17, and overproduction of interleukin-6, which leads to the neutrophilia and all this damaging that you see in the lung, which makes the lung very fragile, where, you know, if you do intubation, you blow them up. So you don't do intubation, especially early intubation for those lungs. Try as best to do intubation when you have the hypoxia or the oxygen saturation into maybe 70, not what we learned below 90 and just go intubate them and blow up the lung. And that's what's happening. The disaster that happened during the management of COVID-19. There's pressure intubation because those lungs are very fragile because of the neutrophilia and all this protease enzyme and catalytic enzyme that's breaking up the tissue of the lung. And so the spike protein that the coronavirus is blocking the ACE2, it's blocking the anti-inflammatory arm of renin-angiotensin system, and it's allowing this hyperactive angiotensin 2 type 1 receptor signaling, which leads to polarization of the immune system, excessive polarization of the immune system to Th17, M17, and overproduction of interleukin-6, and neutrophilia, of course. And so it's a neutrophilic pneumonia, neutrophilic damaging of all the organs of your body. And not just that, those interleukin-6, when it's overactive, it stimulates the clotting process. And so you have this hypercoagulation status of those patients. So their D dimers are high because of this excessive interleukin-6 and this sort of inflammation. And oxytocin does inhibit that, inhibit the whole process from blocking the virus from attaching to the ACE2 receptor. That's one part. It increased the mucus production and electrophorin. We're going to learn that. It helps to neutralize those viruses, preventing them from inhibiting the ACE2. To the other side, which is inhibiting the polarization of the immune system into Th17 and production of interleukin-6. So it has immune modulation. It buffered the NOx enzyme and it decreased the free radicals. So it does have anti-inflammatory and antioxidant and antiviral effect that is very suitable drug for managing and preventing coronavirus. And not just that, because it's activation of the mitochondria, improving the endothelial function, balancing the autonomic nervous system, because we know that the angiotensin type 2 or angiotensin 2 type 1 receptor signaling, it also activates the sympathetic activities and inhibit the parasympathetic, right? And so if you block that, what would happen with oxytocin? You increase the parasympathetic, you drop the sympathetic. And we know the parasympathetic is anti-inflammatory, sympathetic is inflammatory. And in doing that, it definitely helped to manage the whole post-COVID-19, where we see there is imbalance of the autonomic nervous system. There's too much of activity of sympathetic and less activity of parasympathetic. That's mean sympathetic release norepinephrine activate the NOx, generate free radicals, trigger and aggravate any existing inflammation or any chronic disease, and makes it even more worse. So you need to have something that inhibit the sympathetic and stimulate the parasympathetic, and oxytocin does that, whether directly the working on stimulating parasympathetic and inhibiting the sympathetic, or indirectly by through the renin-angiotensin system, by blocking the inflammatory arm and stimulating the anti-inflammatory arm by freeing those ACE2 receptor from those virus block, from the spike protein blocks. And because of all of this effect of oxytocin, I think oxytocin will be the Golden Globe winner for managing and preventing COVID-19, and also using it for managing post-COVID-19 syndrome, where post-COVID-19 syndrome, you have mitochondrial dysfunction, and we know oxytocin helps to reverse that. Post-COVID-19 syndrome is causing endothelial dysfunction, and we know oxytocin helps that. We know that post-COVID-19, they have mitochondrial endothelial dysfunction, autonomic dysfunction or imbalance, and we know oxytocin balance that as well. And what else we have? It helps to get rid from the senescent cells, from the inflammasomes, and so it does help to reverse and all the pathology, and helps to reset the homeostasis of the body that we needed to manage post-COVID-19 syndrome in general. It makes sense? It definitely helps to increase the expression of antioxidant enzyme, which is, we're talking about the catalase, superoxidase, dismutase, and the glutathione peroxidase enzymes and all that good stuff.
A quick question.
Okay. Yes, go ahead.
Yeah, really quick. The graph that you showed, it was a couple slides ago. It was showing, yeah, that one right there. It was showing that the increase in AMPK causes an increase in UCP2 activity, and that helps with the mitochondrial uncoupling. What is the UCP2?
It's part of the mitochondria that leads to, in a state of proton going to the ATP synthase and making ATP. It bypasses it and it goes through other channel, which is the UCP2. So you don't make ATP. You're just getting the proton go in, react with electrons, and generate heat. So it's kind of a way.
So
yeah.
Is it like an alternative to the ATP synthase?
Yes. So you don't want to produce ATP, because if you produce ATP, you inhibit the AMPK. And AMPK will be activated when you have low ATP and high AMPK, which is the adenine monophosphate, right? So adenine monophosphate stimulate the AMPK, the kinases, but ATP inhibit it. And so one of the way of doing it, you don't want to produce enough of ATP here. You want to produce more of adenosine monophosphate to activate the AMPK, because that gives you the body a signal that we don't have energy. We need energy. So then that will cause the activation of AMPK, which will activate the mitochondria, and it will activate the autophagy process and all that stuff. So that's how the mitochondria uncoupling. So it's in the state of proton goes and make the ATP. So the ATP synthase, there is uncoupling here, because coupling is that you have the electron transport chain is coupled with making ATP, right? That's a coupling. I don't want to make ATP. I want to burn those fat. and I don't want to generate ATP because ATP blocks the AMPK and blocks the autophagy. So I want more of AMP, which is adenosine monophosphate, right? And so it's a process to signal further autophagy and getting rid from all the senescent cells and all that. And that's happening during dieting that you're talking about. And it makes sense?
Yeah, yeah. I mean, as I've been going through the mitochondria like more in depth, you know, I realize there's so much more going on, and how it's communicating, you know, mitophagy and autophagy, and how it's, you know, there's a lot, you know, the more I look into it, the more I realize that there's more to learn. And so yeah, that one was unfamiliar. Is that UCP2, is that like part of the, like, is that on the
It's in the mitochondrial membrane, the inner membrane. It's a pathway for the proton to go in and bypass the ATP synthase. And so you're generating heat if that's the case. You're not conserving the energy in the form of ATP. It's a thermogenesis, right? And but this is the process where we can burn more fat and also induce autophagy. Because if you have too much of ATP, this will inhibit the AMPK. And if you inhibit the AMPK, you don't get enough of autophagy and fatty acid oxidation and lipolysis, which that's something we need. You got my point? So this is called the mitochondrial uncoupling here. Make sense?
Yeah, it's getting there. Yeah, you know, I mean,
No,
I feel like
I'll put a slide there for that.
Yeah, I feel like I've got to just spend more time with it, because you know,
Yeah.
with the protons going across the membrane, you know, I would think that that would, are they going in, like from outside in, and
from outside in, but not to the ATP to make ATPs. It's gonna bypass it, right? It's like breaking the circuit, or and so you generate heat. Hydrogen will go in and neutralize with those electrons and generate heat. And it's a thermogenesis. It makes sense?
Yeah, yeah, no, it does actually. Okay, no,
Right.
thank you.
Okay, so and so here we see that oxytocin, just by inhibiting the NOx and by inhibiting interleukin 6, we know that it does help to manage all chronic disease across all medical specialties that we're talking about. We know also that oxytocin, so it inhibits interleukin 6, the polarization of the M17 and TH17, but also to increase the expression of antioxidants. And so if I induce any damage into the lung, like if I do an experiment with mice is being subject to some toxic to the lung, inflammatory free radical generator, and the other group of mice that are not, or both of them, sorry, being exposed to the damage, which is, let's say, lipopolysaccharides from the bacteria, right? Sepsis. And then I give oxytocin to one group, another group, no. So what will happen to the group with oxytocin? You will have less damaging in the lung. Why? Because oxytocin expresses the NOx enzyme and it decreases the inflammatory cytokines. And versus the group where there is no oxytocin, they don't have a protection. And if we slice those lungs of those mice in both two groups, you see more damage, the one without oxytocin versus the one with oxytocin. And so we see here that oxytocin helps to manage inflammation and decrease the inflammation in all organs, not just the lung, heart, lung, brain, kidneys, gut. So it definitely helped to reduce the damaging effect of any hyperinflammatory responses. And that's what's happening in COVID, right? In COVID, you have hyperimmune response. unnecessary inflammation that's causing all the multi-organ damage, and mediated by M17, Th17, interleukin 6. And we know that it does suppress it. And it does suppress the free radical generation. And because of its anti-inflammatory, antioxidants effect, we can use oxytocin to manage heart failure, myocardial infarction, ischemia, pneumonia, lung fibrosis, name it. Inflammatory brain diseases, degenerative brain diseases, pyelonephritis. We can use it, anything that damages the kidney, and possibly may help patients with renal failure as well. And because it helps to manage leaky gut syndrome, it can help the inflammatory, it manages the inflammation of the gut. I can use it for managing peptic ulcer, pancreatitis. It does help to manage fatty liver, hepatitis, all of this. Oxytocin would definitely can be used to manage all the inflammatory diseases, all the autoimmune diseases, all degenerative diseases of any organ out there, metabolic diseases, so name it, because of its anti-inflammatory and buffering the redox, and also helps in restoring all this metabolites back to normal. We saw the sex hormones increase. We saw how it's buffering the cortisol, all the good stuff, right? So that really gives us an authority to say oxytocin is a potential adjuvant against COVID infection, right? And we know why, because it blocks the whole pathophysiology of the spike from A to Z, of the spike protein or the COVID from A to Z, all the pathophysiology there, right? It blocks the ACE2, it prevents ACE2 from blocks the spike protein from combining with the ACE2, right? And then if you do that, then you stop the whole inflammatory inflammation that's mediated by angiotensin 2 type 1 receptor overstimulation. And you restore the anti-inflammatory arm of the renin-angiotensin system by doing that. It also helps to stimulate the priming or inhibit the priming of the spike protein by inhibiting the protease enzyme, right? What else? It inhibits the nuclear factor kappa light chain, so that it inhibits the NOx enzyme. It inhibits the TLR, which is the toll-like receptor, which is this when your macrophages is being activated by encountering pathogens, how the macrophages they signal to polarize from naive into M17. The TLR will react with this polysaccharides or with this spike protein and or with the fragments of the virus or whatever. So if you're able to inhibit that signaling of activation of macrophages, then you are inhibiting the inflammation from the start of it. And so if you see here, the whole mechanism of oxytocin, it's more than just blocking the attachment of the spike protein into the ACE. It's really more than that. And if you see the COVID-19 or COVID spike protein, how it works, we know it stimulates the overactivation of the inflammatory arm of renin-angiotensin system, which is the angiotensin 2 type 1 receptor signaling, right? And doing that, you also increase the sympathetic overactivities. See, this is the angiotensin 2 when it become overactive by reacting with angiotensin 2 type 1 receptor. And then that signal the whole inflammatory and polarization of the immune system into Th17, M17. See the cytokines here, the inflammation here. And in addition to that, the coronavirus, because of this, the inflammatory arm of renin-angiotensin system also activate the sympathetic activity. See the sympathetic become overactive, and it's a vicious circle here. and the sympathetic will release the norepinephrine, and norepinephrine stimulate the NOx, and then the NOx will generate free radicals. So the free radicals, along with this inflammatory cytokines, will cause all this damage, will cause inflammation in the lung and then the heart, and it will aggravate diabetes because it will block those receptors, oxidize those insulin receptors, and make them insensitive. And definitely it will cause atherosclerosis because you have this inflammation, you have all this free radicals, this oxidation of the glucose and glycans, and macrophage got irritated, and you have oxidized LDL, and all this can lead to atherosclerosis and aggravation and triggering all those chronic disease and bringing those subclinical diseases in to become clinical. And so we see that oxytocin can inhibit all of that just by inhibiting the or blocking the spike protein from attaching the ACE2 and preventing the spike protein from inhibiting the anti-inflammatory arm of renin-angiotensin. You can reverse the whole process that we learned here. In addition to that, oxytocin also works on stimulating sex hormone, especially estradiol. And we know that estradiol does help to, estrogen help to increase the mucus production, especially the lactoferrin. The lactoferrin is a component of the mucus that neutralize and attack the virus, and neutralize the virus and the spike protein. So if you neutralize the spike protein, you're preventing spike protein from attaching the ACE2, which is something that's what we want, right? So more mucus production and the quality of mucus production where it has an antiviral lactoferrin production, definitely this would help to neutralize those viruses, preventing it from blocking the ACE2 as you see it here. Did you see this here? This proteoglycans and the heparin sulfate, how they are going to combine with the virus spike protein and preventing it from attaching to the ACE2, which preventing it from blocking the anti-inflammatory arm of renin-angiotensin system here. What else? Also, we know that the oxytocin will inhibit the serine protease, and this will prevent the priming of the spike protein, because spike protein will not combine with ACE directly like this. They have to be primed, they have to be clipped by proteases, and we know that oxytocin inhibit that. So the spike cannot bind with ACE, cannot block the anti-inflammatory arm of renin-angiotensin system, and that will manage the whole process of COVID and preventing it and managing it. We know that oxytocin stimulates the thymus gland to secrete all those thymocynes, peptides, the good ones, the beta, the alpha. So it stimulates the immune system, and also it stimulates the Tregs, so it has an anti-inflammatory effect. And we know it really inhibits more of Th17 and M17 overactivities. That's very important. Because if you inhibit that, then you restore or resume the polarization of the immune system to Th1, and that Th1 and interferon will help to clear all those infected cells with those COVID viruses. What else? We know that if you inhibit the sympathetic, what will happen to the parasympathetic? It will become active again, and then the parasympathetic will increase the mucus production as well. It helps the healing process, the anti-inflammatory of the parasympathetic, and we know about it, right? And so if you see, oxytocin helps to balance the autonomic nervous system. In post-COVID-19 syndrome, they have too much of sympathetic overactivities. They have less of parasympathetic, and means of sympathetic overactive means more inflammation, more norepinephrine, more activation of NOx enzyme, while parasympathetic means more of nitric oxide, and that will neutralize the free radicals, and then the hemoglobin will recycle the peroxynitrates back to nitric oxide and water. So parasympathetic, it's a very powerful anti-inflammatory, and the parasympathetic inhibits the sympathetic and inhibits the norepinephrine release, and it increases the secretion of the saliva and the tear and all that good stuff, the mucus, which will help to neutralize those viruses and preventing it from attacking your body. I think this is just the same thing we talked about, just in another shape, but and so if I have two group of mice and I inject them with a free radical generator, right? lipopolysaccharides or whatever free radical generators, any toxic, and I give one group oxytocin, the other one no oxytocin, what would happen when I start slicing those brain of those rats? You will see less inflammation, less damage, less microgliosis in the one that's being treated with oxytocin versus the one without. And so it does have an anti-inflammatory. It does help to curse the gliosis. And knowing that, we know the gliosis, inflammation of microglia, mediate all inflammatory brain diseases, post-traumatic disorder, brain trauma, what else? Dementia, what we call motor neuron diseases, multiple sclerosis, name it, all those inflammatory, degenerative brain diseases. Part of the pathology is microgliosis. And if the oxytocin helps to inhibit the microgliosis and inhibit the inflammation and promote GABA, well, GABA is anti-inflammatory, right? And inhibit the interleukin-6 overproduction, inhibit the NOx enzyme, definitely this will be a very effective anti-inflammatory drug for all the inflammatory brain disease. So it's a neuroprotection, as you see it here. And it just shows you how the oxytocin helps the lipopolysaccharides signaling inflammation, whether in the brain, the microglia, and equivalent is macrophage in the peripheral. You see that it inhibits the signal. It have we know the lipopolysaccharides, they will combine with macrophages or the microglia, and how the macrophages will recognize and activate and become inflamed is using their toll-like receptor 4, especially, that will lead the polarization of those macrophages or microglia into M17 or TH, which will lead to polarization TH17 to interleukin-6. And you see oxytocin here inhibits that. So inhibit those macrophage polarizing into M17, TH17, and producing interleukin-6 by inhibiting the signaling of the reaction or the macrophage with lipopolysaccharides. It's like the macrophage, how they taste those lipopolysaccharides and how they be primed and activated and polarized into M17. They by a toll-like receptor, they react with lipopolysaccharides, and that leads to the polarization into M17, those naive macrophages or naive microglia. And if you can inhibit the signaling of that, you inhibit the polarization, definitely you can use this oxytocin to manage inflammatory process, whether it is centrally, which is mediated by microglia, microgliosis, or the macrophages where they polarize into M17, and then that leads to polarization of the TH naive into TH17 and into interleukin-6, as you see here. And so very clear how the oxytocin work in inhibiting the inflammatory cytokines, especially the TH17, M17 pathway or signaling, and how that would help to manage all the inflammatory process. And also it increases the expression of antioxidant enzymes and buffering the redox. So if you have low free radicals, low inflammatory cytokines, especially the inflammatory cytokines of TH17, M17, which is interleukin-6, then definitely you can manage all chronic disease of the brain, inflammatory, autoimmune, degenerative, post-traumatic stress syndrome, or traumatic brain injury, and name it. Just by a stroke, ischemic stroke is inflammation as well, right? The whole process of ischemic stroke is part of it is inflammation, in addition to shutting down the blood vessels. But we know the oxytocin increases the blood flow. It does stimulate angiogenesis, and it has anti-inflammatory process. So we can use oxytocin for a patient with stroke. Yes, definitely, sure. And it definitely helped to buffer the redox and all this free radical generation, inflammatory process of the stroke, and it opened up the blood vessels. I mean, come on, this is a good thing. If you have patient with stroke, just give them intranasal oxytocin. Call Dr. Mike Beamer, and he can send you the ones that he has. And I trust the one that Mike Beamer has because of the quality, and I used it myself. I don't know about if I get it from other places. You know, you need to make sure the concentration is right, the amount of oxytocin, because I don't trust those mass production of oxytocin out there, especially if it's not from a reliable source. So very important when you get your oxytocin, get it from people that you trust. And maybe, you know, the old experiments of oxytocin where some has good result on autism, other they don't. Maybe because the source of oxytocin is not that right source. So, and also the dose it was not right dose, it just was very low. You can go up to 100 international unit of intranasal oxytocin because absorption is going to be 4%, maximum with light 10%, which is 10 international unit. And we know we are injecting into the mother almost 50 international unit, up to 50 international unit when we are using labor or delivery or contracting the uterus. So we're trying to use the lowest dose at the pharmaceutical dose allowed, and I think up to 100 international units is okay for intranasal. For subcutaneous, I don't go above 10 international unit, and I will start with 2 international unit around the umbilical. Why around the umbilical? Because I want oxytocin to go to your fat viscera and burn that fat by activating the AMPK enzyme that we talked about, which is the kinase that leads to lipolysis and fatty acid oxidation, expression of antioxidant, activating the mitochondria, turning the white fat into brown fat, and so we see here intranasal oxytocin can be used to manage dementia. You know, dementia is mediated by what? I mean, what's the pathophysiology of dementia? Dementia is part of it. You have degeneration of the neurons, especially the acetylcholinergic neurons, right? They don't produce enough acetylcholine. And if you go to a specialist, a neurologist, they call themselves neurologists, and they will say, okay, so we have dementia, we have less amount of acetylcholine is less because acetylcholinergic neurons is being degenerated. So how we manage it, give them the drug that will inhibit acetylcholinesterase, that will increase the bioavailability of acetylcholine, and whatever the name of the drug they come up with, acetylcholinesterase inhibitor, there's many names, hard for me to memorize them. I don't know if anybody here memorized those names, but neurologists, they have all the names because the big pharma gives them all this beautiful pictures and all that names, which is exotic names. And they say, here we go, and go home. Okay. We as integrative doctors, some of them, they become so extremes, then they start doing crazy things. They end up losing their credibility with the mainstream medicine. Especially with those doctors who are claiming if you shine a light on vitamin C, you don't need to get the vitamin C, you just get the quantum effect of it. Then that they damage the name of integrative and regenerative. The doctors are claiming the stem cells can do everything and can reverse your cartilage and all that. Those false claims, ends of the mainstream medicine would take those false claims and destroy this field of medicine. I think integrative and regenerative are a good field, but it needs to be done in a right way, and not making false claim where the mainstream medicine will take advantage along with the big pharma so they can promote their products versus the natural products. And so that's the reason we come up with chronic disease prevention management. So we can say we are the middle. We don't do the extremes of the regenerative, integrative, or holistic, and we don't do the extremes of the mainstream medicine, where they're just shooting the vaccine without knowing the safety of the vaccine, for example. But at the same time, they are using those big pharma products chronically, and we know using those big pharma products chronically is not compatible with the mitochondrial, and most of the time it has their reverse and tolerance, like opioids, for example. It induces oxidative damage into the brain and leads to the tolerance, and the patient becomes like a zombie, addicted to those opioids. So we need to be in the middle here. And as chronic disease prevention management, we have these 3 pillars, okay? And we need to restore the metabolism of the body, we need to buffer the redox, and we need to modulate the immune system. So when we manage dementia, dementia is 3 things. There is immune imbalance, there is too much of Th17, M17 polarization, and Th1, which we need to reverse it back into Th2 and Treg, okay? That's part of it. So it's immune modulation, and we need to work on it so we can slow the process of degeneration of neurons. Okay, and also we will do this like the mainstream medicine, increasing acetylcholine by inhibiting acetylcholinesterase. So that's the metabolic part, right? But then we also think, well, the degeneration is caused by excessive constant amount of free radicals and pathological free radicals. So we need to screen all those pathological free radicals, whatever gets into the body, whether from the leaky gut or from the leaky brain or from the environmental toxins free radicals. All of this needs to be screened and we need to neutralize it, okay? And so we're doing detox, we manage the leaky gut, the leaky brain, and we modulate the immune system. So we're looking for a way to increase the Treg and inhibit the Th17. So we're giving low dose naltrexone, we're giving oxytocin, we're giving dihexa, all of this to help to modulate the immune system and balance it so that you don't have overactive of Th17 or Th1. And at the same time, we look at all the other metabolism in the body, vitamin D, vitamin A, all those hormones, sex hormones, and we need to restore all of that, because if there is low vitamin D, then you have the body prone to have more free radicals, because vitamin D helps to stimulate the expression of the antioxidant enzymes and helps to recycle those waste and all those free radical, neutralize them, preventing those slow the process of degeneration. Because you need to buffer the redox, modulate the immune system, balance the immune system, and then yes, you need to increase acetylcholine bioavailability by inhibiting acetylcholinesterase. But that's just not enough. You need to really work on all the trigger that leads to degeneration of the neurons. The mainstream medicine, they don't care about the degeneration of the neuron. They say it's gonna happen, we cannot stop it, okay? But we can just go ahead and give them the metabolic part, which is inhibiting acetylcholinesterase. That's in us, we say we can't stop the process of degeneration. And oxytocin also, not just that, it helped the deposit of those amyloids, and it helped the deposit of the tau, all those misfolding. It can have the misfolding of those proteins, which is a good thing. Most of the people with neurologists, they don't care about the inhibiting the misfolding of protein, because it's going to say they're going to happen. We cannot stop that. And also, we add curcumin to tag those amyloids and recycle them. And oxytocin helps also to recycle those amyloid and those tau protein as well, preventing it from misfolding. And if it's folded and it's plaque and deposit, the oxytocin along with curcumin may help to recycle them as well. And see, this is very important to show biochemistry how the oxytocin inhibit the whole process of the misfolding of the protein and tau protein, as you see here, or the beta amyloid plaques, as you see here. The oxytocin inhibit the process and the signaling and the pathway of misfolding those protein from happening, as you see it in this picture here. Well, neurologists are not interested in this, and that makes us way better than them. We are more, and that's the reason why AMA came up with this new field of medicine. It's called chronic disease prevention and management, to train the doctors to be more skillful and to be able to manage chronic disease with these three pillars that we talked about. Restoring the metabolism, and yes, restoring the acetylcholine bioavailability is restoring the metabolism, but also buffering the redox and modulating the immune system, shifting the immune system from Th1, Th17 into Treg and Th2, and getting rid from all those toxins that irritate the macrophages, whether through the leaky gut or leaky brain or environmental toxins. And also activating the expression of antioxidant enzymes. That's very also important by giving the, making sure the vitamin D is there, the sex hormones is being restored back, especially the estrogen, which you see it there. And so we need to restore the whole homeostasis of the body to really manage dementia, not just by narrow focused tunnel that the current neurologists do. And that makes the chronic disease prevention doctor more effective in managing chronic disease across all medical specialties. And the other thing, if you label yourself a chronic disease prevention management, then that will justify you to manage those diseases. So the neurologists, if they complain to the board American Medical Association and say, hey, that doctor is not specialized in neurology and he is managing dementia, and you need to stop that doctor from doing that, right? That's what the doctors do, right? Okay. But when they go there, oh, this doctor is chronic disease prevention management. It's a new field of medicine. It's kind of an upgrade of all the medical board specialty there. So he's okay. So if you want to become like him and you can manage even diseases, not just for neurology, from other medical specialties, then you need to work with us as well, the AMA they have a very big program for that. They have, in each state, they have this kind of field is being promoted. It's a new, it happened after the COVID, triggered by the COVID, because COVID triggered all those chronic diseases. And we see the failure of the mainstream medicine in managing it. So they're looking for doctors to upgrade their medical specialty to become more comprehensive and managing all these diseases. And so if you have dementia, you cannot say, well, you know what, I'm a neurologist doctor, I don't care about diabetic and your cholesterol, go for another doctor, endocrinologist, to manage that. And if you don't manage the patient's diabetes and you don't increase its insulin sensitivity, you have all this glycans from the glucose in the blood that will generate that will speed the process of degeneration of the neurons. So you really need to have a doctor who can take care of all of this, and instead of the patient jumping from one medical specialty to another, and everybody's giving him advices and filling up a bag of drugs, and you get all this conflict between all those drugs that's being given, and possibly they are counteracting each other. Okay, go ahead, Dr. Juice.
Hey, yeah. So, as I've been thinking about this, because of the complexity of the language, that the language of the cellular biology, sometimes, I'm getting used to it as far as really, I'm seeing the same things over and over. And, occasionally I look to, try to see what the abbreviations mean, so I can just have a picture in my mind of what's really happening. But the one thing I can see, and I think the last slide, if you don't mind.
Which one? This one?
Yeah, is the commonality. See, you got GSK 3 beta, ERK, 1/2, caspase 3. Well, the commonality I see is first and foremost is I really looked into kinase. Okay, kinase in general means towards or movement, I guess, or kinetic. But what it really is those are on-off switches, literally on-off switches. And what I see is the off switch being put to anabolism, and the on switch to catabolism, which is increasing metabolism, increased mitochondrial function, which is increasing autophagy. So, for example, increasing autophagy so that like the beta amyloid plaques can be recycled or digested, broken down. And then the neurofibrillary tangles, I think it was when we went to Boston to do the training, I was reading the article I was reading. I remember the neurofibrillary tangles are basically neurons that have almost are starting to go into mitosis. Now, neurons shouldn't go into mitosis. And so when you think of mitosis, you picture the, I'm trying to think of the words, but the picture the lines, as the cell is going to separate, and you might be able to help me, but those tangles, you see, that's like mitosis that has been stopped halfway in between. So it's stuck in an in-between state of replication, and that's abnormal. Well, that would be anabolism. Okay, so the way I see it is the way we are naturally in the United States, we're in a anabolic state. We are in a constant sort of growth state, and we're not in the catabolism, breaking things down, auto-digesting, stimulating stem cells, bone marrow stem cells to, create a balanced immune system. And so I if we were in this constant anabolic state, growth phase state, well, that would make sense for eventually the neurons would start to kind of undergo uncontrolled replication, but be stuck because they're not supposed to. They get stuck, and the neurofibrillary tangles is what it looks like when a cell is halfway through mitosis, and it's not normal. And so that's what I'm seeing. If I were to break it down, shift, and everything is a perfect science with the body. So when you turn something on, the other thing goes off, and kinase is the great decider.
Right. So let me go ahead with word kinases. Most of the kinase enzyme are enzymes that lead to phosphorylation, adding phosphate group to enzyme to turn it on. So there's phosphatase and there's kinases. Phosphatase is the opposite. So they take the phosphate group out of the enzyme, possibly activate it or block it. So depend. Kinase is enzyme that add phosphate group to the enzyme, whether it's going to block it or activate it. It depends on what this enzyme it's about. So it's way of turning on and off the enzyme by adding phosphate group or taking it out of it. And adding a phosphate group is by kinases. And taking out of the phosphate group is phosphatases. So it's turning on and off those signaling pathway by turning off and on the enzyme activities itself. So those are the interpretation of kinase versus phosphatase. Now, regarding neurons, they don't divide. They are all the time static. I mean, they don't, when we reach the adulthood. But what happened to those neurons with age is that they need to get rid from the proteins that they make, the old ones, the deformed, defected ones, those defected machines, because proteins in our body is either structure or functional, protein or enzyme or functional or structural. But when they get damaged, you need to recycle them and renew them, and your neurons will go ahead and destroy them and then recycle them, make a new one. Now, the enzyme set, the set of enzymes and the machines that helps in breaking those proteins, with age, they become inactive. Okay, they become inactive. And when they become inactive, those defected proteins, the neurons cannot get rid. It's hard for them to get rid from them. And then they get misfolded as well into a protein that cannot even be recognized by your enzyme that normally breaks those proteins. They become like a stuck, and it's like a trash. The neurons will fill up with trash of protein that cannot be degraded because they are being misfolded. Okay, and they accumulate and they squeeze the whole cells and possibly generate free radicals, because they are free radical generators as well, and that leads to induce apoptosis and kill those neurons, and leads to eventually dementia or Parkinson's or any other of those diseases that's happening there. So what we need is to get rid from those bad misfolded protein and preventing those protein from misfolding in the beginning.
Right.
Oxytocin helps in doing that. Curcumin helps in doing that by inhibiting all those signaling pathway that misfold those protein into a plaque or neurofibrillary plaques, where it's hard to get rid from it. And if it's there, also it helps to activate enzymes and maybe change them in a way they become recyclable again, and the body gets rid from it. So we see here all the pathway that leads to misfolding of this protein is being blocked by those oxytocin. And those enzymes that you see here, it's part of the process of misfolding those protein. Oxytocin prevent that from happening. And also, if they are misfolded already, oxytocin helps to recycle them. Same like curcumin, tags them and make them in a way that becomes degradable. It makes sense?
Well, what I'm trying to do is distinguish tangles and plaques are different. The plaques are the accumulation of the misfolded proteins, like you said, they're unrecognizable, they clump together, and
Right.
they trigger oxidative stress. My understanding is that the neurofibrillary tangles are from a disrupted, neurons that are starting to undergo mitosis, and they shouldn't, and you start to get the whatever the when the cell divides, you have those, when it looks like it's threads pulling apart, and
Right.
they pull apart nicely. Well, what my understanding is that, okay, so you have this disrupted neuron, it's got plaques, and then it's got its functions become disruptive, and they want to go through mitosis, but they kind of get partially through mitosis. So that's where the neurofibrillary tangles come from. Is
Right.
that the same
No,
thing?
no.
And
It's that neurofibrillary tangles, even definition here, it's an abnormal accumulation of protein called tau that collect inside the neuron. So it's the same and like amyloid, but just a different way of misfolding.
but
Makes sense.
there's no connection to uncontrolled mitosis. Because
It just those are misfolded proteins, whether it's the neurofibrillary or amyloid. They induce apoptosis and kill the cells, and you don't want that because that will lead to dementia. That will lead to decrease the volume of acetylcholinergic neurons. So you need to stop that from happening.
So we don't want apoptosis. We want to, first of all, we want to prevent it from getting to that point.
Right.
But if it's already
Right.
sort
We
of
need
getting
to
to that
stop
point,
killing those neurons and induction of apoptosis by those trash of protein that the neurons cannot get rid from it because they are in a misfolded protein that your own enzymes cannot recognize it. So we need to prevent it from misfolding from the beginning. And if it's misfolded, we need to tag them and turn them to become biodegradable again. It's like trash that's not being taken out. Think about if you don't take your trash from your apartment and it's accumulating, what would happen to that?
yeah,
They have all this toxic
I can relate.
Right. So the same thing happened to the Parkinson disease. We know it's mediated by, or it's caused by degeneration of dopaminergic neurons, and dopaminergic neurons with age and possibly some genetics as well, that they don't have enough of enzymes to buffer and recycle the waste, and also to get rid from the quinins, which is the byproducts of the dopamine, right? Those are free radical generators. And so the enzymes, the superoxide dismutase, and all those enzymes are not enough to neutralize those free radicals. So you have too much of free radical generators, which is the byproducts of dopamine itself. And that's causing, speeding the whole process of the degeneration of more dopaminergic neurons. And so we find out that oxytocin, because of its anti-inflammatory, antioxidant, may help to slow the process of the degeneration of dopaminergic neurons. And that's possible. We can use oxytocin intranasal to manage possibly Parkinson's disease. And I think Dr. Patel have some cases with Parkinson, and if she tried with them. Did you report any good news with intranasal with Parkinson's disease? Because we don't have clinical cases yet. We all.
Dr. Halasa,
Yes.
I have treated a patient who was not able to tolerate any medicine for Parkinson's disease. And when he came, he was almost just typical Parkinson's gait and everything. And I did treat him with the oxytocin. I also treat him with the HCG hormone and few other things. The oxytocin did help him to stabilize. Number two, he was on medicine to sleep at night, and he was just using one spray twice on each side of the nostril at bedtime, only one time a day, and he was able to get rid of his sleeping medicine, which was like I think it was like Valium. So, so what I'm trying to say is, I told him to use 2 sprays in each nostril 4 times a day, but he followed his own instinct and he just say, I just need only 1. So between HCG and oxytocin, we really have changed the game. Now only the muscle rigidity is what I am working on it. And I'll let you know what works for that.
Well, dihexa will be a good one. Mike Beamer has some patients, they are on dihexa. So I want you to reach out to Mike Beamer for the dosage.
But what dihexa does? That's what I need to know.
Dihexa, do you remember when you talked about renin-angiotensin system? It has 2 arms.
Yeah.
It has inflammatory and anti-inflammatory arm. And do you remember when we said the angiotensin 2, if they react with angiotensin 2 type 1 receptor, that's the inflammatory vasoconstriction arm. But at the same time, angiotensin 2, when they are converted by ACE2 enzyme into angiotensin 1 and 7, then that will give you the anti-inflammatory arm. The angiotensin 1 and 7 is the dihexa. One of them is either angiotensin 4 something.
But how will it will help his muscle rigidity? That's a
Well-
muscle rigidity in the neck. So his neck is very tight.
Well, if you decrease the inflammation, you decrease the stunning of those dopaminergic neurons. Because see what's happening. In order to manifest with Parkinson, you need to have almost 75% of your dopaminergic neurons inactive. Okay, and then the Parkinson will manifest. Okay, let's think about it. That in reality, not all those 75% of the dopaminergic neurons are dead. Let's say 50% are dead, and 25% are stunned by the inflammation, and 25% are still functioning. Okay, but 25% is still functioning, but it's not enough to put a brake to stop the tremor of the Parkinson disease. Okay, so when we're doing our treatment, whether you're using your dihexa or using your oxytocin or using your 6-hormone HCGC, which stimulates 6 hormones, or using glutathione, reduced ones, IV, you're not really doing much in reversing the dead cells because they are done. There's nothing left there. But you can reverse the 25% that's been inflamed, that's been stunned. And if we are able to take the inflammation out, we can get those 25% function. And so you still, now you have 50% of the dopaminergic function, and that will stop the Parkinson manifestation. Did it make sense? Did I got through your message? So dihexa, it's an anti-inflammatory. You're adding it to the oxytocin and to your HCGC. HCGC, whether it works directly or indirectly by stimulating the 6 hormones, and 6 hormone does have an anti-inflammatory effect. So you are kind of working on different.
Well, I am helping his muscle weakness.
Right.
And all of that is better. So dihexa, okay, it is anti-inflammatory molecule, and you give them and neuronal restoration that you reestablish, but you are going to put it in the same nasal spray with oxytocin, or it will be
I don't think there's any conflict between both of them, either separate or together. That's you and Dr. Mike Beamer can discuss that about the reaction and all that, whether it's soluble or not soluble fat. That technical, that's for Mike Beamer. I don't know if he's here.
He's not here?
I don't know. Mike, Dr. Mike, are you there?
Yeah, I'm here. Hey, guys. Yeah, I'm cautious about mixing peptides in the same product, but you may be able to. I would have to do more looking at that.
I tried, and it precipitates.
Yeah, I think you have to look at what they are, like some will get along and others won't. I think if they're little tiny peptides, it's a lot different if they're large peptides.
So what is the strength that you use that for dihexa?
I only use it in oral. Oral capsules are usually around 2 to 4 milligrams, something like that, typically. But you know, you have to look at the literature. There's different dosages for based on weight, but a typical starting dose is 2 milligrams. I know that. Now, as far as intranasal, would you use it intranasally? I would have to look at that again, you know, and see. I haven't been asked to do that before. I do have dihexa, and but I've only been asked to do it in capsules before so far.
So Dr. Halasa, you think the intranasal would work better than oral?
Yeah,
I prefer intranasal, but even oral, it works because Mike Beamer has patients with the same thing you talked about, with Parkinson conditions, and they feel better, way better. I myself, I know those
Tell
patients.
us a little bit about that patient?
What is that?
It's can you tell us about the patient that?
No, this privacy thing. But you know, I mean, he's around 70 years old, and he has problems with his speech. And when he started dihexa, his speech, I mean, I can understand him now, and he is becoming active and great. And he attributed to dihexa. Now I think he's adding oxytocin, but Mike Beamer knows more about the case, and he can talk about it, but without mentioning the name. Go ahead, Mike.
By the way, dihexa goes up to 20 milligrams according to Pure Pharmacy. So they've got 5 milligrams, 5 milligrams, 10 milligram, and a 20 milligram capsule.
Right. Mike knows more about the case. If you want to go,
yeah, you know, you're right. It does go higher. You can go higher. I mean, I was talking about a starting dose, you know.
Right.
But yeah, I'm looking here. I don't know that I would do it nasally without further research, but I would need to look a little bit here.
Oh, nasal dihexa would work very well. I think there is some.
It's about whether you can do it, you know, like whether, like, for example, will it dissolve? Like I'm looking here, it's soluble in things like DMSO. I'm seeing caution with adding water to it. I'm seeing people putting acetone in it, you know. So yeah, there's some things to look at here. Not everything everybody does is like, okay. You know?
Yeah, but there is already in the market some dihexa intranasal.
Yeah, that's what I'm saying. I need to know who has it, who's making it, and how they did it. Because
so sterile water, if you use it, it dissolves.
if it dissolves in sterile water, that's okay. I've never tried.
You cannot put the sodium chloride in it, otherwise it precipitates.
Okay, all right. I have never tried it. I have some dihexa. I can try it and see. So, but yeah, at this point, Dr. Patel, I'd have to do a little bit more work to make sure. But certainly the oral's no problem. I'm you know, if you know, a nasal spray dissolves in water, we're fine there. I don't think it's a problem. But as far as, you know, what is the shelf life? Does it get along with other drugs, things of that nature? I'd have to do more research to know.
Right, but there is the dihexa nasal spray already in the market. So anyway, let's do this. I mean, I will continue up to 10, and then if then I have to stop because it's too much for you guys. And then we can do it next Monday. But I'm trying to be more slow as much as I can, so that we will have this interaction discussion as much as we can. And tomorrow also, I'm going to present this with Dr. Bill as well, Bill William, the whole thing. But I will go slow, and if at 10 p.m., just Mike Beamer say, hey, 10 p.m., we can stop, and then we can continue next Monday. So again, the mechanism how oxytocin helps to manage and prevent all the neuroinflammatory, neurodegenerative diseases, all of them, whether Parkinson, multiple sclerosis, ALS, name them. The mechanism that there is common pathophysiology among all of those diseases, which is microgliosis, and oxytocin helps to manage that and decrease the inflammation, and especially the polarization of microglia into M17 and Th17 and interleukin-6, right? The other thing is that it does help to promote the GABA pathway, and that's very important because the GABA will help to decrease the inflammation as well and calm the neurons from being overactive. So it counteracts the glutaminergic neurons. We know the glutaminergic neurons mediates the nociceptive pathways, and we know that nociceptive pathways, when they are overactive, they can stimulate the sympathetic. And then you have this vicious circle of sympathetic glutaminergic neurons,
All good.
and that
All
will
good.
lead to inflammation because of sympathetic release of norepinephrine that stimulate the NOx and generate free radicals, irritate the microglia. So anything that helps to dump and helps to calm the glutaminergic neurons, the nociceptive pathways, whether in post-traumatic syndrome or all those neuroinflammatory diseases, it does help in decreasing the inflammation and this vicious circle of, and that's happening in complex regional pain syndrome and migraine, where you have this nociceptive sympathetic overactive, and that leads to microgliosis as well and inflammation. So the GABA helps to calm that, inhibit the glutaminergic activities, and it does help to even work directly on the microglia and inhibit the calcium entry, which mediate the whole inflammation. So it blocks it. And it helps to calm and give you that anti-anxiolytic effect, and definitely anything that helps to suppress the glutaminergic neurons activities, which mediates the activities of nociceptive, helps to give you that pain relief. And if you reduce the pain, you reduce the inflammation, because then the pain is connected to the sympathetic, and the sympathetic leads to an inflammation because of the NOx. And if you reduce the pain, you reduce the inflammation of the brain, and that definitely give you the whole mechanism of oxytocin as an anti-inflammatory, antioxidant, and also it helps to stimulate the GABAergic and blocks the glutaminergic. And definitely this helps to give you that
Dr.
calming
Halasa,
focus in it.
have you seen that the pain causing the increase in platelet count?
Well, if it goes increase the inflammation and interleukin 6, it does help to increase the clotting effect, possibly. I know it increased the coagulation and clotting effect and the damaging of the endothelial cells. So that maybe leads to that as an
But
activation.
that is platelet,
Okay.
increase in platelet count is independent.
Yes, but again, I'm just saying that if you increase the inflammation to interleukin 6, you're increasing the coagulation status of the patients.
Right,
And
but
also you're causing damaging to the
that is the
endothelium.
coagulation cascade, not related to platelets.
Yes, so I'm not sure about directly linked to the platelets, increasing the platelets, if the pain increased the platelets, but I know it increased the clotting tendency, because indirectly, not directly.
Many of our patients, when they are sick and inflamed, we will see a high platelet count. So what do you relate that increase in platelet count to?
We need to find if there is any signaling from interleukin 6 that increase the platelets count. I know it increased the coagulation effect, damaging the endothelium and the D-dimers, but I'm not sure about the link directly to the platelets. But we need to investigate that, and I will look at it. And if there's any signaling for increase the platelets, then we will look at it. Does it make sense? Okay, so oxytocin and migraine. We need to understand the migraine pathology, and it is neuralgia.
Stop now?
What is that?
I thought you were going to stop now. And
okay, is it enough? You want to just you want to finish the migraine, or you want to do it for the next?
I think it's a completely a new subject. You may want to do it next time.
Okay, good. That's fine. So, any questions?
Yeah, I wanted to just elaborate because I didn't have the words to describe what I was talking about with the neurofibrillary tangles. and I found the article that I'd gotten it from, but apparently the tau proteins typically they are stabilizing the microtubules, and and when they become dysfunctional, they then destabilize the microtubules. But there was some mention that with a certain amount of oxidative stress, that the neurons, instead of undergoing apoptosis, they start to enter the cell cycle, and so they are, and what I mean by the cell cycle, I think like they want to go through mitosis, and that's abnormal when they should go through apoptosis. And I think that's an advanced, when it's more at its advanced stage. But the tangles are from the destabilization of the microtubules because of the dysfunctional tau protein.
Right. As a clinician, we're trying to make it simple and simplify the science, because we just want to know give me the butter, give me the things. And so we can just say the tau protein is misfolded protein. It could be part of the microtubules that you're talking about. And the cells are not able to get rid from it because they become misfolded into neurofibrillary process there. And we need to get rid from it. And we need to prevent it from happening, those misfolding. And oxytocin helps to prevent those misfolded proteins, whether it is tau or amyloids. And we need to get rid from it and recycle them when they are already there. And so there's two processes: preventing it from misfolding, and if it's folded, you need to tag it and look for a way and express the enzymes that helps to break them up and recycle them. But I think you need to tag them and change them first. And curcumin does that, helps to tag them. And then oxytocin will help to express all those enzymes that would helps to break those tagged misfolded proteins, whether it's amyloid or tau misfolded protein.
So what did you say? Curcumin does what?
It helps to tag them, turn them into more biodegradable.
Misfolded proteins?
Yes. So I would like to combine curcumin with oxytocin when I'm trying to manage dementia, along with all other things that we talked about.
You're talking about oral curcumin.
Yeah, you can do even intranasal curcumin as well, if it's not irritant. And that's where I like intranasal, because it's just the way to get into the blood faster and into the brain.
Too large. Molecule is too large.
That's not going to happen, guys. Curcumin is like hot peppers. There's nobody.
Right, it's just irritant. That's the problem with it. Even oral, it's fine if you increase the bioavailability of it. Okay, any other question? There's a lot of text. There's 8 texts. So is it questions, those texts, Mike Beamer? Can you see them?
What?
No, there's really not. No, there's not really questions there. They're just kind of some statements.
Okay.
Anybody
wants to come up to the mic and ask questions, how they can become part of us more and dig more, and how to get all those products from Dr. Mike Beamer, how they can present their cases, because I'm just giving the headlines. I'm waiting for Dr. Patel to bring cases like what she did right now and more. I'm looking for you to translate this into more clinical and give me cases. This is the patient. You don't give me names, and we don't need the names, just the age and their conditions as anonymous patients, and tell us what you did and how it works and what other things you add into the protocol. Like I'm proposing adding curcumin to the oxytocin, to the dihexa, add methylene blue as well, add NAC and acetylcysteine, add platelets nanoparticle, load them all that there. Also work on add thymosin beta, so you can polarize the immune system into Th2. Add erythropoietin, the peptide possibly, and just create that protocols for dementia or for Parkinson. And I want to, what you're adding, vitamin D, all this thing that you did to come up with a complete protocol. And you can start with oxytocin, and then you start building up based on the response of the patient. Some of the patients will respond to the oxytocin and you save a lot of money. Some of them, they need curcumin. Some of them, they need dihaxis. Some of them, they need an extra layer of methylene blue, NAC, alpha lipoic acid, cod liver oil, vitamin B6. So you build these layers of adding things, and based on the patient response, you create your own personalized protocol for that specific patients. I'm against that the big pharma where they're copycat, everybody takes the same. That's waste of money and effort, and some patients respond to this and that, don't respond to that's because of the variations. And some of them, they have fungus infection, they need to be taken care of that. Some of them, they have toxins, environmental, needs to be taken care of that. Some of them, they have deficiency and malnutrition. And all of this needs to be done in a personalized manner. And I need all of you to come up and say, hey, I have a case of migraine with oxytocin and other things that I'm adding. I have a case with Parkinson with oxytocin, other things that I'm adding. And then you come up with a clinical case and you present it to us. And that's how we learn. It's not just enough for me. I'm good in mechanism of action. Yes, that's my structure as an INTP, but I need to hear other doctors from all the different personalities. Some of them, they focus on clinical trials. Some of them, they focus on, the outcomes, efficacy, how the patients feel. They're more into emotions and the feelings of the patient versus the mechanism of action. It's because of different personality that we are as doctors, it affects our approach and methodology of treating patients. But I want to hear all this because it's like different colors, and it's more fun. It's the beauty of science when you have all this debate and discussions and different approach and different angle of managing those conditions. So please, come up with your cases and let's hear from you and learn from you. I'm against one way of learning. I like both way of learning and discussion and debate and scrutinize and verify. Without that, we are more passive, and I'm looking for more active group.
Okay, I do have a case that I'm working on. A patient with 60-year-old patient with a female, Jamaican female, with a history of a hysterectomy when she was 45 years old, who started to have memory loss as early after her hysterectomy, that became worse through her 50s and then got worse, especially during the pandemic and after taking the vaccine. And so I have been treating her with, I've been treating her for a year, mainly with the tools that I had previously, methylene blue. I did intranasal exosomes, something that she asked me to do. She knows it's experimental. And I've also treated her with dihexa. And for the most part, she had increased concentration, feeling better. She hasn't made the kind of memory mistakes like she did. Like, one of the big ones before I started treating her is she backed out of her garage before letting up the garage door, causing major damage to her garage door, her SUV, so things like that, or leaving her keys in the front door, all day long, not even realizing it, or forgetting, like people at her church, like that she's known for years, cannot remember their names. But she says she still has memory problems, but they're not as bad. And then I added the oxytocin, and the feedback I received, and this has been for about 2-3 months, is that she does it in the morning. She prefers to take it in the morning because she says she likes the way it makes her feel. She's very much a type A personality, ESTJ, kind of controlling and kind of OCD. She runs a business. She's a very good businesswoman, runs a home health agency. And she basically is more relaxed. She says she feels better. She's not as high strung or getting angry as much. So I'm still waiting to find out again how her memory is doing. And I'm also, I don't have a good test yet to implement. I've treated her mostly just clinically. I mean, I've done the testing as far as looking for other things, lymphocyte test, array 12, to look for other, pathogens that may be responsible. I'm going by her history, the workup she had before she started seeing me. She went the regular medicine route. She tried one of the typical pharmaceutical Alzheimer's medications. I don't remember off the top of my head, and she didn't like it. She wanted to try the natural route. And so this is where I'm at with her. Now, I guess the only debatable thing is she wanted to change her program with me, which limited the amount of different peptides that I could give her. I definitely kept the oxytocin. She's taking the carotenoid supplements from the what's the company that has the that we work with, that has the photon light that measures the carotenoids in the skin.
Right.
So she has those. She wanted those, but I had to stop the methylene blue. But I'm tempted to just start it back up anyways. It just didn't fit her budget. But my whole thing is, now this is where I've gotten a little bit stuck with methylene blue, because I know that we would use it for acute situations and use it for a length of time, but we didn't necessarily use it indefinitely. And I like the idea of going indefinite, because we don't know what kind of pathogens we're coming across now. But it sounds like oxytocin may be providing a certain level of protection that we didn't have when we only had methylene blue. So my debate is, should we, continue the methylene blue on top of the oxytocin? Do we need it? The other debate is, if we are chronically on antioxidants, and my mother was going through some studies on chronic use of antioxidants, that's not necessarily a good thing, because our body needs to, we don't want to buffer all oxidative stress. If our body still needs to produce bursts of oxidative stress for, certain very important processes. And so when I thought about that, I thought maybe methylene blue is something we use more when we need it, but we don't have to buffer all the oxidative stress all the time. You see what I mean? And so that.
What about using through the nose with the oxytocin, the methylene blue, in a 0.1% dilution?
Right.
So
1% to 0.1, whatever.
Well, let me add something here. If this patient is having dementia, I think it's good to continue with 10 milligram of methylene blue. And the reason, because the studies of methylene blue is being used for Alzheimer and dementia, which is, they tried 100 milligram versus 10 milligram. They find it's the same. So you don't give them 10 high dose, just little dose, 10 milligram
Her
daily.
illness, Dr. Halasa, her illness started after having the hysterectomy.
Right.
We don't know what other, and it was
I think she has low sex hormones in the beginning, and that leads
right.
to the
So estrogen is very important. Estrogen and progesterone are very important for the memory and mood. So
Right.
yes. So I did have her right from the beginning on a estriol combination with DHEA, testosterone. This is a cream, testosterone and progesterone. And the rationale was because the studies I came across were of women having hysterectomies at 45 years or younger, having that kind of abrupt change in their hormones causes them to have an increased risk of early dementia. And
Right.
so it fit perfectly. It's the
Right.
abruptness at such a young age that leads to the early dementia. And so
but
yeah,
because they develop the endothelial dysfunction. And
Right.
endothelial dysfunction and that results into that many times I have seen patients with the TIA attack, and
Right.
they have been reversed by the hormones. And sometimes it even just giving the dilution of progesterone even helps them. So I like all the newer molecules, but we should never forget our old friends, and which are the really physiologic molecules. And
Right.
so it's important.
yeah,
Well, the
and that was
oxytocin would help to even tune those sex hormones. So they stimulate sex hormones, and so it just helps to synergistically adding to your sex hormone that you're adding, but also it helps any side effects or anything like that. It helps to counteract that, especially when you're adding testosterone. You may increase aggressiveness and all that stuff. So oxytocin is with sex hormone works very good and harmony and minimizing any side effects of sex hormones if there's any, especially when you're adding the DHA and all that stuff. And I think,
Pregnenolone, we should not forget pregnenolone.
yes,
which is the
yes,
progesterone.
I just added pregnenolone because of
Right.
one
And
of the
another
lectures.
thing is NADH.
Right, and ADH will be good.
Right.
Dihexa will be
It
another one.
works. It works.
Right. So if you add all this, I think you will be a winner. But for this patient, because of her dementia and all that stuff, she will feel better not to take the methylene blue. Continue taking it 10 milligram daily until she
Twice a
feels
day.
super.
Okay, so 5 milligrams twice a day.
5 milligram twice a day will be enough. 10 milligram daily in general, that would be good. That would be good. And
And
then
what
whatever
about
she's pumping in the morning, that's good. I think she's doing it night and morning for oxytocin. She feels good. That's okay, because up to 100 international unit of oxytocin is still in the safer side, especially if you split it into many doses, because the time life of oxytocin is very small. Now, regarding giving antioxidant all the time, yes, you need to have some sort of a spark of burst of free radicals, and that's coming up from the time dieting. So it's better if you time diet. It does help to generate that spark of free radicals that you need to get rid from all those inflammasomes and senescents and cancer cells.
So I didn't quite understand that last
Dieting,
part.
that time restricted diet, just one meal a day, it will be good for us. Better versus 2 meal. I think it's better than and have that period of you don't NOP, nil per mouth, will be good for at least 10 hours or 12 hours, 16 hours. It depends on what time is restricted.
Yeah, the
A
time
combination
restricted.
of this with oxytocin with what you're doing, she will feel way better. Now, how you examine memory, we can just test her. What you ate in the breakfast last night, last day or yesterday, for example. What do you have in the breakfast yesterday or before yesterday? Who's the president of before Bush? Who was the president? Just recall, asking those simple questions of memory, short and long. In short term, you just say, hey, table, chair, doctor, office, and then ask her if she can repeat those. And see the short-term memory, long-term memory, just by asking simple things that may help you to assess their memory function, whether it's good or not. Especially asking the breakfast of the yesterday, that's kind of requires some memory, because we do that every day. They get confused a little bit. But if you know what's your breakfast yesterday, that's mean you have a very sharp memory. If you ask me, I doubt I would call it.
Okay, and by the way, the time restricted eating, according to the article I presented, was really going from 3 meals to 2 meals. and so having a lunch and a dinner and skipping breakfast is the simplest way to think about it.
Or having
Um,
breakfast and dinner and skipping the lunch. It's the same. I like to have a space between food, like, you know, at least 10
Well-
hours between the meals.
Well, yeah, I mean, this is specifically in this study, it was 8 hours of that's the time you do eat, but it's strictly 16 hours without eating. And
Right.
so, I mean, it was very precise. I just wanted to also mention that Dr. Patel had mentioned the nasal spray for methylene blue. And with the dementia, obviously, again, it's going more straight to the brain, or at least that's how we see it. And so, and maybe that's the way to go about it.
We already
versus
have
going-
oxytocin is already mixed with methylene blue, according to Mike Beamer, right?
Yes, we have that.
Oh,
Yeah.
oh, we do.
I
Yeah, you
received
have
it.
that, and it's the same price. It doesn't cost any different.
Now, does it come out? No, you know, sometimes I have to cater to complaints that I feel like, you know, it's like, well, I mean, it bothers her that when I gave her the PNP nasal spray, she complained that you know, it runs a little bit, and you know, so she would have like a little bit of blue coming out of
Yeah.
her nostrils, which is
Yeah.
to me, it's like, yeah, but we're trying to get your memory back. This is, you know,
Yeah.
a little bit of blue isn't gonna, but you know,
Right.
everybody's
Yeah, it's
different.
not that
Everybody's
blue.
different.
Yeah, I'll send you some. I'll send you some so you can see it. But no,
I
it's
don't
not
see
that
any
blue.
staining with it.
It's
I'm
not-
using it.
staining. Yeah,
it's
I
not that
reduced
blue?
it down. I really think it should be stronger, to be honest with you. But I had the same feeling, you know, if you know, nobody wants like blue, you know, blue snot coming out of their nose. But it you know, like you say, I did it is at 0.01% or 0.005%, right in that range. It's not real staining.
This
Oh,
is
okay,
it.
that's
Do you
great.
see it?
Mm.
Can you see Mike? This is the one they sent me. Right.
Oh, wow.
So it
And-
does
and
have
the-
blue color.
Yeah, it has a light blue color, but it's not like dark
Right.
blue, like the oral solution that we were using. That's real dark. It's not like that.
So if you see it, there's
Okay.
some blueness there.
and the
Right.
price.
So
of,
let me add
it's a
something
price-
here.
it's a
Oxytocin
price-
helps to stimulate stem
Same.
cells. So if you mix the oxytocin with your stem cells, I see Dr. David Steen here. He's the stem cell guy. Dr. David, are you there? So if you mix your stem cells with oxytocin, you can have more better effect because it stimulates the differentiation of the stem cells to whatever tissue you inject. So if you
Yeah.
inject to the
How much?
cartilage,
How much?
I would go with start with 2 international unit because that's what's being injected into the epidural. So and mix it with the stem cells to 2 international unit and then inject it into the joints, intranasal, whatever. So because it stimulates the stem cells.
Make sure you understand too. He's saying the number 2, not 200. 2, the number
2
2.
international unit.
2 internationally, 2 IU.
Which there is a conversion between international unit and microgram, but I forgot. There's just not that much different. It makes sense.
And then the
Okay,
price
so
of
Dr.
the-
David Steen, are you there? I hope you enjoyed the meeting tonight because you said you want to attend it.
Yeah, thanks. I was just trying to get Mike Beamer's contact so we can order the oxytocin.
Right, right. How is California? Is it cold?
Say
How
what?
is California? Is it cold? Or it's good, the weather?
Yeah, the weather's great. What can I say?
Right, right.
Sunny and wonderful. Come on out, guys. My claim, mi casa, su casa.
Okay, so everybody's happy. Do you have any questions?
Hey, Dr. David, I've just put my number in the chat for you.
Okay, so
Oh,
next
great.
week we'll finish the whole lecture. I still have some slides, like another 50 slides. But I will go through all the system. I'm adding a stroke as well. So it's good for a patient with stroke, oxytocin, and in the coming slides, we're going to talk about the mechanism. But there's many conditions, and I mean, many good slides in front of us. Migraine is a very good one. We're going to talk about it next Monday. But again, please apply what you're learning and then give us the feedback and more information and your protocols and what you did and how your patients feel. And because all of this will be collected by Mike Beamer as a pharmacy, and he is the hub of delivering the medication and also receiving the feedback. So everything you do, so we can learn how to do it better and upgrade the protocols. And then Dr. Mike Beamer will be reporting those protocols or putting it down in writing and possibly sending it along with those scripts. So you have some guidelines about how to do the management for certain conditions based on the reports from 3 or 4 doctors using the same thing. So it's not just oxytocin. You really need to add all other things if needed. And if the patient is not responding enough with oxytocin, and then we can build up the protocols based on that. But we understand the concept, the TIMI, the logarithm, that's very important. And then you can create your own, the equations, and then you can create your own protocols based on the feedback and based on the inputs of the patient's labs and status of the patient. So it become personalized medicine versus, you know, everybody.
Hey, I'm gonna cut you off, Halasa. It's 10 o'clock.
Okay.
Yeah,
So everybody's happy here.
Just one last little question. The oxytocin, are we talking twice a day for two sprays in each nostril,
Yes.
twice a day?
I think that's better. I've been seeing your scripts and you're telling people once a day. I think that's fine for starters, but I think you know, assuming if they tolerate it, okay, I would go right to twice a day, AM and PM. You're not going to overdose the patient.
Well, are they? I mean, is there enough when we?
Oh God, yeah. There's 300 sprays. I'm giving you guys 300 sprays in a bottle.
Okay,
There's a lot.
And how much per spray? How much international unit per spray?
12.
Well, that's a lot. 12 multiplied 300. Do you know how much international unit there?
It's a lot.
It's like 3,000 international unit.
Yeah, it's definitely
That's a lot.
it's definitely a generous supply. And I do that to make sure that while we're going through this testing, we may find out that 15 mLs is enough for a patient, but we want to find out, you know, I want to make sure people aren't running out and you have the opportunity to raise the dosages without running out, making people buy stuff they're not sure about twice, all that. So it's better to give people a good quantity, you know, and it's the same, it's, you know, the same, you know, it gives you the dosage option. But yes, 1 spray in each nostril twice daily, I think is a good starting dose for most people. If you want to be a little bit more conservative and just have them do it at bedtime, at nighttime, you know, for a week or something to be sure, you know, maybe you have a sensitive patient or something like that, then that would be, you know, fine too, I'm sure. But I think you're going to get a better effect at twice a day.
No, that's fantastic. I'm glad we cleared that up. So yeah, I'm gonna get the for her, that patient, I'm gonna have it with the methylene blue then, and then she'll do it morning and night. And like I said, then there's another level that I think we can, you know, that we might get to. So and perfect, awesome, thanks.
Yeah, no problem. Good to talk to you, Dr. Joseph. Oh, I'll see you
we'll see you next Monday.
I'll buy you a beer in Vegas. That'd be a steak dinner in Chicago. In Vegas, you only get a beer for the same price.
I don't know. I need to figure out how to.
Are all you going to be in Vegas?
Beer fits into my diet. What's that?
Are you all going to be in Vegas? Because we want to see you all there.
I'm going to be there.
We'll be in Vegas. I'll be in Vegas. So yeah, and we'll talk about that. But that's coming up. So I'll see you all out there if possible. But that's always a fun trip. It'll wear you out. I promise you that. And you'll learn more than your brain can hold. But that's what it's for. It's fun to do that, right? So, but anyway, God bless y'all. Thanks for coming tonight. We'll see y'all next week.
See you next Monday. We're going to finish all the slides.
Yep. Thanks a lot.
Awesome.
Take care.
All right. Thanks. Yeah.
Good night.